Hello friends, welcome to my channel Doctor Online 24/7. Today I'm going to tell you about thyroid problems. Among all hormonal problems, thyroid diseases are the most common ones. Thyroid diseases can be divided into three major groups. There is an excessive production of the thyroid hormone, which is called hyperthyroidism. There is decreased production of the thyroid hormone, which is called hypothyroidism. Multiple nodules or generalized swelling of the thyroid gland is called a goiter. Hyperthyroidism means that the thyroid gland is producing excessive thyroid hormone. It causes increased metabolism, which consumes a lot of your energy. It is the main reason why people having hyperthyroidism feel tired. Many people with hyperthyroidism are also nervous and stressed, which makes them even more tired. Hyperthyroidism can be treated. Hyperthyroidism has many symptoms because all of the processes in the body work much faster. Common complaints are feeling warm, shortness of breath during exercise, loss of strength, menstrual problems, weight loss, increased heart rates, diarrhea, and psychological complaints like fear and irritability. These symptoms usually do not all occur at the same time. In some cases, the thyroid gland might also be enlarged. The most common cause of hyperthyroidism is Graves' disease. It is an autoimmune disease, where your body produces antibodies to stimulate the thyroid gland, which produces excessive thyroid hormone, more than the requirement for normal functioning of the body. Graves' disease may also cause eye problems. Unlike hyperthyroidism, hypothyroidism means that the thyroid gland produces decreased thyroid hormone, which leads to reduced metabolism. Symptoms of hypothyroidism are feeling tired, feeling cold, heart problems, increased in weight, depressed feelings, hair loss, and deeper voice, and bowel problems. One of the common causes of hypothyroidism is Hashimoto's disease. In Hashimoto's disease, there is an immune response of the body against the thyroid gland, which causes decreased function of the thyroid. Hypothyroidism can result from treatment of hyperactive thyroid. Thyroid disorders can also be caused by changes in the structure or form of the thyroid. In some cases, the thyroid might be enlarged. Goiter is one of the most common thyroid problems. When you have goiter, the thyroid gland gets enlarged and there is visible swelling in the neck. Goiter has several causes such as infection, iodine deficiency, benign or malignant disease. A malignant disorder is extremely rare. When you have goiter, there can be a problem in swallowing or breathing. Before treating goiter, the underlying cause must be determined. Thyroid problems can be diagnosed with blood tests and sometimes using a thyroid scan, or a puncture. Other times thyroid swelling disappears even without treatments. Hypothyroidism can be treated with thyroid hormone pills. Depending on the cause, hyperthyroidism can be treated with medication to reduce the production of thyroid hormone. Another option is treatment with radioactive iodine to stop the function of thyroid cells. Surgery can also treat hyperthyroidism. Goiter can be treated with surgery or with radioactive iodine. Do you have any symptoms which might indicate thyroid problems? Please consult your general practitioner for advice. Homeopathic treatment for thyroid diseases. Some of the commonly used homeopathic treatments for thyroid diseases include fucus vesiculosis, calcarea carb, iodine, bromium, lycopus, calcarea phos, lapis albus, and spongia. That's it for today. Hope this video is beneficial for you. Thanks for watching, Doctor Online 24/7 by Dr. Sana Bawani. Don't forget to like, share, and subscribe my channel.